Hello and good morning. I am Dr. Rachna Singh, Consultant Obs and Gynae, working at CK Birla Hospital for Women. This is a hospital dedicated specifically towards the needs of women. Today I will be talking about PCOS. PCOS or PCOD is a disease, as full form describes, Polycystic Ovarian Disease. This is the most common endocrinopathy which we see in the reproductive age group of females. Usually prevalent between the age of 18 years to 45 years, we see practically 1 out of every 10 women suffering from PCOS. Coming to the pathology of PCOS, actually there is a very complex pathophysiology behind it, and not one element is such that we can pinpoint and label as the cause of PCOS, but usually the problem which we see is with the insulin resistance, which we find to be increased in the patients of PCOS. These patients can present to us at variety of clinics. They can present to the gynecologist, they might just be seeing the dermatologist, or might just be the first presentation is at the metabolic clinic. Usually the complaints which they come are related to their periods, it could be related to acne and increased facial hair, or might just be the weight gain. To diagnose PCOS, there are certain criteria which have been prescribed. They are under the headlines of Rotterdam criteria, and they include: first, the ultrasonic findings of PCOS or the polycystic ovaries, in which ovaries are shown as making multiple cysts of smaller and bigger sizes with a general increased volume of ovaries. There could be increased facial hair, acne, or maybe signs of increased blood sugar in the body. And the third is an ovulatory periods. That means periods are becoming either irregular or they totally disappear at all. Out of these three criteria, even if two are present, we diagnose the patient as PCOS and we start working up. So, coming to the treatment for PCOS, it depends on the patient, their requirement, and what are their plans for the future. Whether they are wanting to be not planning a pregnancy, or they are keen to conceive. Also, these patients sometimes do not have any symptoms, and the first presentation happens at the infertility clinic because of the smaller issues wherein they are not able to conceive. So, coming to the treatment, if the patient is obese, the first criteria is to go in for a BMI, and after that advice for weight loss. Weight loss is basically a diet and an exercise regime, and then we do certain investigations regarding the hormones, and if anything comes in that, then the treatment follows accordingly. If the patient is having anovulatory cycles and the problem is actually less or irregular cycles, then the most common preferred treatment is OCPs with or without the hormonal therapy. If the patient is keen to conceive, then after the workup, usually the treatment is ovulation induction. Induction can be done with again certain medications like clomiphene or letrozole, and weight loss, and maybe if the blood sugars are found to be high or there are signs and symptoms which says hyperglycemia, then we do prescribe anti-diabetic agents, something like metformin, which can be taken by the patients. So, PCOS is not something which will disappear from your body just by treatment, but there are adequate modalities wherein, depending on the problem, we can work out the treatment. It is easily manageable given that you are keen to manage your diet, your exercise regime, follow certain protocols and therapies which your doctor prescribes, and surely we can beat PCOS at its own turf. Thank you.